This is a controversial issue at this time. Some medical organizations have recommended not to perform prostate cancer screening. Now, we have seen that since PSA screening has become widespread, that the risk of cancer death has dropped about 30%, which indicates that prostate screening is reducing the risk of patients dying from prostate cancer. However, there's concerns that prostate cancer is overdiagnosed and overtreated. Prostate cancer tends to be a fairly slow-growing cancer. A man can live with prostate cancer for many years. Some patients may never develop a problem from that prostate cancer. If you overdiagnose the condition and overtreat the condition, a lot of patients are going through screening, they're going through biopsies that have some risk. The complications of surgery or radiation treatment can be significant. It can cause quality of life issues. And some of these patients may be treated that don't really need to be treated because they never would develop symptomatic prostate cancer during their lifetime because they could die of something else first. The screening process involves the PSA test and the rectal examination. If the PSA test is high, that might trigger a biopsy. If the rectal examination is abnormal, that might trigger a biopsy. On the other hand, you have to look at other factors: family history, how old is the patient, what's the patient's age, what's their rate of PSA change. So I have a lot of patients these days that may have a high PSA, but I'm not biopsying them, I'm watching them. I don't put them through a biopsy procedure unless I have strong evidence to do so. In the same way, when you find a prostate cancer, you have to approach it in a very careful and thoughtful manner. You have to look at the patient as an individual. You have to, again, look at risk factors. Look at what's his life expectancy. Look at again, what's the PSA change, or what we call the PSA velocity, or what's PSA doubling time. Screening for prostate cancer becomes less controversial if it's approached in a more thoughtful manner. The thoughtful approach is trying to select out those patients that are at risk of suffering from prostate cancer from those patients that are not likely to suffer from prostate cancer. These decisions can be based on the patient's family history, what the PSA level is, the volume of cancer found on biopsy. But the point is that prostate cancers are slow growing. Surveillance is becoming an increasingly common approach. Surveillance means that once a diagnosis is made, if the patient has low risk factors, this patient can be watched carefully over time without aggressive treatment.